afternoon, and welcome to Maine Public Health Association's 2020 award ceremony. My name is Becca Bolas, and I'm Executive Director of Maine Public Health Association. For those of you that are unfamiliar with us, we are the state's largest and oldest association for public health professionals. We advocate, advise, and educate about public health in Maine, and I am just so excited that you're here joining us. This is a very special event. It's one of my favorites that we host, and I'm looking forward to celebrating our Public Health Award winners. So thank you all again for being here. Many of you I know have worked with our awardees on key public health programs across the state, and on behalf of MPHA, I want to thank you as well for your time and your commitment to protecting and promoting public health in Maine. This is our schedule for today, the presentation order of the awards. And one item that I do just want to share with folks is that we are offering closed captioning. And so if that's a service that you would like to use, if you go back to the main menu in the conference website, you'll see on the left-hand side a menu option for closed captioning. And I will also say that if you have any issues or questions with connectivity, please use the discussion feature that you'll see in the session right where you are now. And either Frederick or I will monitor that and try to help you out the best we can. I do want to thank Frederick. He's our support from Event I, which is this platform that you're using for his very generous assistance pulling together all the different videos that we're going to be showing you. There was a lot of technology for this session, and I want to thank him for his patience with that. And I also want to thank our board awards and nominations committee for their time reviewing the nominations we received and selecting tonight's winners. As you can imagine, there is a lot of impressive work going on in Maine, and we received many strong submissions. And I want to thank everyone as well who took the time to submit a nomination. So with that, let's get started. Our first award today is the President's Award, which is the highest award given by MPHA. Nominations are solicited and vetted by MPHA's past presidents, and I want to congratulate Carol Kelly, who is this year's award winner. I feel like everywhere I go in public health, I see Carol. She was nominated by Lisa Miller and Ed Miller, who will now share some remarks about why they nominated Carol. And Fred, over to you for the recording.
It was not hard to nominate Carol for this award. She's been such a key player in major public health efforts for decades. From her early days leading the Robert Wood Johnson Smokeless States Initiative to her current work on the opioid epidemic and Public Health Reimagined, she has played a pivotal role, period. Look almost anywhere at public health policy and advocacy efforts, and you will find Carol's fingerprints, such as obesity prevention, rural health care priority setting, the Fund for Healthy Maine mobilization, environmental policy roadmaps, and MPHA grant collaboratives. She's a consummate behind-the-scenes actor, and she's a talented strategist, an expert in health communications and messaging, an excellent facilitator, a great grassroots organizer, and a gifted media wonk.
It was my pleasure to be one of the people nominating Carol Kelly for the 2020 MPHA President's Award. Carol and I have worked together many, many years, and it's a great pleasure to see her honored in this way. She and I have worked together since the Smokeless States Grants that was funded by the Robert Wood Johnson Foundation that accomplished a great deal in tobacco policy in the state of Maine. We've worked together on countless legislative initiatives at the state and federal level, and we've plotted numerous campaign plans together and organized many media events. Carol, I think it's fair to say, is well known for her intensive spreadsheets that she has perfected. In addition to working with her in Maine, we worked together on the American Lung Association's nationwide Healthy Air campaign, and I have been and continue to be impressed with her talent, her skill, her energy, and her contagious positive attitude. Carol, congratulations on getting this award. Well deserved.
So when it came time to find a consultant to help coordinate the Public Health Reimagined work, it was a slam dunk to engage Carol. She'd just come off an incredible body of work conducting numerous community listening sessions across the entire state around the opioid issue. Her grass tops and grassroots contacts have proved immensely valuable. For these reasons and so many more, we strongly recommended Carol Kelly for the 2020 MPHA President's Award.
Great, thank you. And so now, Carol, I will turn it over to you to make some remarks if you would like.
Thank you so much, Becca, and thank you, Ed and Lisa, and the past presidents of MPHA and the board of MPHA. I am humbled and honored, so grateful for this award. My path to public health was an indirect one, and yet it has always felt like a perfect fit, a way to combine my love of systems and puzzles and spreadsheets with my love of doing work that matters with people who are smart and creative and strategic, people who are innovative and kind, people, including all of you, who care about making our state and our world a better place for everyone in ways that respect each other and our environment and the generations to follow. And while I cut my teeth on state level tobacco policy, it's been my work with communities that has shown me what Maine people are made of and how far we will all go to fix things that are broken and lend a hand to a neighbor and come up with incredibly creative solutions that can solve problems for everyone. We've all seen it. Some of the most important public health work in Maine is being done by people who wouldn't even classify their efforts as public health. And they're just doing the right thing for their communities and their neighbors. I love the image of a community fabric and the strength that comes from the many strands, vertical and horizontal, and the way individuals are stronger when woven as a fabric than on their own as a single piece of thread. And I see most of you with the deep issue expertise that you have in public health as the vertical threads that give our public health fabric its shape and its size. I think of myself as one of the horizontal threads among us. I tend to see opportunities in breadth, not depth, which I hope is helping to knit our strands into fabric. And together we are strong and getting stronger. I'm grateful to many of you, including Ed and Lisa, for mentoring me along the way. I'm grateful to every single one of you for doing the critically important work of public health in the myriad ways you do it every day. And I'm grateful for every opportunity I've had to participate. I look forward to continuing our work together in the months and years to come. Thank you again for this tremendous honor.
Thank you, Carol. So next in our lineup is the Public Health Program of Excellence Award. The goal of this award is to increase the visibility of public health initiatives in Maine, to promote adoption of effective public health programs, and to provide recognition to organizations involved in successful and collaborative public health initiatives. Congratulations to Wabanaki Public Health, this year's award winner, recognizing in particular their colored paper project. Last week, I had the honor of visiting their new impressive office space in downtown Bangor and was just blown away by their growth. Their staff size has increased dramatically under the leadership of Lisa, Rebecca, and the other staff at Wabanaki Public Health. And it was an incredible honor for me to be able to spend so much time with them and to learn about the other programs that they are working on. And several of them would be very deserving of this recognition. Heather Drake, MPHA's membership manager, will now share some remarks about why Wabanaki Public Health was nominated for this award. And with that, Frederick, I'll turn it over to you to play her video.
Good afternoon. I'm Heather Drake, the membership manager for the Maine Public Health Association. I'm excited to step out of that role this afternoon and nominate Wabanaki Public Health's Colored Paper Project for the Maine Public Health Association's Public Health Program of Excellence Award. As you heard from Becca, this award recognizes effective, efficient, evidence-based, and creative public health programs and works to increase the visibility and adoption of those programs in Maine. I first heard of the Colored Paper Project in a presentation by Christy Ricker as part of MPHA's COVID Coffee Conversation series as she highlighted the work of Wabanaki Public Health in addressing the COVID-19 pandemic among Maine's Indigenous populations. The program serves Maine's tribal elders who are social distancing due to COVID-19 and are unable to access basic necessities themselves. The Colored Paper Project enables the elders to communicate their needs by changing pieces of colored paper placed in visible areas of their home. Green means I'm okay, yellow indicates a need for supplies, red is a sign for illness, and blue lets people know they could just use a phone call. This form of communication allows the tribal elders to stay safe and comfortable in their homes and minimize the risk of contracting the coronavirus. As part of this project, Wabanaki Public Health has made 360 wellness kits that include the supplies needed for the Colored Paper Project, as well as cloth and paper masks, gloves, hand sanitizer, toilet paper, an activity book, a bar of soap, a crisis number card, and a Wabanaki Public Health pamphlet. Wabanaki Public Health has also delivered more than 750 cloth face coverings across the tribal communities, many of them made by staff and community members. The work of Wabanaki Public Health in addressing the COVID-19 pandemic goes above and beyond, and the Colored Paper Project is just one example of the creativity, efficiency, and effectiveness they have had in meeting their community's needs. I am honored to nominate Wabanaki Public Health for Maine Public Health Association's Public Health Program of Excellence Award, and I hope you can all join me in celebrating their acceptance and successes. Thank you.
Thank you. Lisa Sakabason, Director of Programs and External Affairs, will now accept the award on behalf of Wabanaki Public Health.
Good afternoon, everyone. She Willie One, thank you to Heather for nominating Wabanaki Public Health for the Public Health Program of Excellence Award. And thank you for recognizing our team, Heather, for their innovative and committed work. Also to MPHA, to the board, thank you for your leadership. And of course to Becca and the rest of the MPHA team, thank you for your passion to make Maine a healthier place where everyone can thrive. We appreciate that leadership at Wabanaki Public Health, and we look forward to continued partnerships with you as we move into a space that public health has not seen for a very long time. So really looking forward to our partnership in the future. I want to take just a moment to talk about Wabanaki Public Health. We are a public health organization serving the 5 tribal communities and their citizens who live all throughout Maine and outside Maine's borders. As Becca said, we are a fast-growing organization. Today, as I join you, we are close to 60 team members and still employing more positions. We have offices in Bangor, Holton, and soon to be Washington County. We serve our communities in the areas of youth leadership, environmental health, physical activity and nutrition, culture and education, injury prevention, infectious disease, and maternal child health, and I'm sure there is more. I accept this award on behalf of the Wabanaki Public Health team. I would like to specifically honor our Wabanaki, Washington County team, a strong team of 12 serving our 2 Passamaquoddy communities, which is where the Colored Paper program was held and is the program that's recognized. This program came to us through one of our team members. Blunt's was Dana, who is from the community. She knew what the challenges were in the community, and she knew what would work, what the solutions needed to be. Many of our best public health professionals come from the communities they serve. Blunt's is no exception. We listened to what our team has to say. We try to implement those ideas like we do with the Colored Paper program. So we continue to serve our elders through this program in both Passamaquoddy communities. We do not know what the future for this program is, but what it has made us is very committed to continuing serving in a way that is similar, if not how we've been serving through COVID. I would like to recognize the dozen Washington County heroes that I mentioned from our team. I want to recognize them by name. So in accepting this award, really the people I wish that could be with us today are Sandy Yarmel, Kylie Tompkins, Brianna Smith, Leslie Nicholas, Geo Neptune, April Lola, Newell Louie, Laura Jurowitz, Sonora Isaac, Cyril Francis, Erica Farnloff, and Bluntwes Dana. So thank you all on behalf of the Wabanaki Public Health team. Thank you for all the work you do, MPHA, and we look forward to hearing about the other public health amazing professionals that are out there in the state each and every day. Thank you all.
Thank you, Lisa. Our next award is the Ruth S. Shopper Memorial Award, which recognizes an individual who has made a significant contribution in the area of public health. The individual will have demonstrated a broad orientation to health promotion and disease prevention that extends beyond his or her specific profession or field of interest. Rebecca Hoffmann Francis is this year's award winner. Aurora Smalden will now share some remarks about why she nominated Rebecca for this award. And I'll turn it over to you, Frederick, to play the recording.
Good afternoon, everyone. My name is Aurora Smaldone, and I'm a project director within the Clinical Innovation Department of Maine Behavioral Healthcare. It is my honor to introduce Rebecca Hoffmann Francis, my supervisor, mentor, and friend. As the Senior Director of Clinical Innovation and Training at Maine Behavioral Healthcare, Rebecca has brought in over $5 million in federal funding to Maine to address issues of childhood trauma. Through implementation of multiple federal and locally funded projects, she has successfully overseen the creation of a statewide trauma-informed system of care, coordinated a statewide steering committee, and championed trauma and ACEs screening within Maine's largest healthcare system. Her department has also achieved wide-scale impact by training over 10,000 child and family serving providers on the effects of trauma on youth. Her transformational work and zealous advocacy on behalf of trauma-exposed children and families has significantly improved the lives of so many in our state. Thank you, Rebecca, for all that you do.
Thank you. And I will now turn it over to Rebecca if you would like to make some remarks.
Thank you so much, Becca and Aurora, and to the Maine Public Health Association for this truly wonderful award. I am so honored to receive this. First, I want to give you a mental image of where I am right now. My office is a tiny corner in my children's playroom. There are Nerf bullets strewn all over the floor, Pokemon cards on my desk, and Legos under my feet. I'm surrounded in clutter. It's joyful clutter, the kind that speaks of fun, but clutter nonetheless. The circumstances are not ideal. I'm sure we would all say that. But I think that we've all learned over the last 7 months that we can still thrive in these less than ideal circumstances. Children that have experienced trauma are no different. They are in less than ideal circumstances. Some of their circumstances are absolutely unimaginable to us. And our job in mental health is to create that corner of the playroom, the one that offers order and safety and the ability to thrive and grow. People don't go into mental health or public health for the glory. You often don't see the positive impact that you've had on someone's life or on a population. It may take months or years after you've worked with a family for positive change to take place. For me, the glory in this work happens on multiple levels. At the micro level, it's bearing witness to the journey a child or family takes when they begin healing from a traumatic event, and getting to walk that journey beside them as they courageously face their pain head on. At the macro level, it's being able to be part of this public health journey. In Maine, where combating child trauma and adverse childhood experiences, or ACEs, is happening everywhere now. 15 years ago, ACEs rarely received a mention. and now it is on the front line of public health conversations and action plans throughout Maine. There are so many people who have linked arms to ensure that every child in Maine has the opportunity to feel safe and to know that they matter. I'm grateful for these partnerships in this journey. My greatest glory in this work is my incredible team, the women I work with. These are strong, smart women who are also passionate about changing the trajectory for children exposed to trauma, and often do so on a shoestring budget, as we in public health are used to. They make going to work every day a joy, and I learn from their passion and persistence every day. This work can be painful and hard at times, but the sunlight they bring to it makes it all worth it. So thank you to my wonderful team. This truly is an award for all of you as well.
Thank you, Rebecca. Our next award is the Phebe Conrey King Access to Healthcare Award. This award recognizes an individual or individuals who have made a significant contribution to improving access to healthcare in Maine. The individuals will have demonstrated leadership abilities in promoting increased access to healthcare by all people in Maine, and will have made a significant contribution toward meeting the needs of the uninsured and medically underserved in the state. Kate Ende is this year's award winner. Ann Willison will now share some remarks about why she nominated Kate for this award.
Hi everyone, I'm Ann Willison, Executive Director of Consumers for Affordable Healthcare. Thank you for being here today, and thank so many of you for your work on the front lines, helping meet the healthcare needs of people during the pandemic. Really appreciate all you are doing to meet the healthcare needs of Maine people. I'm here today to briefly recognize Kate Ende, who is receiving the Phebe Conrey King Access to Healthcare Award from the Maine Public Health Association today. And I can go on about Kate. 2 minutes isn't a lot of time, especially given all she has done and continues to do on behalf of Maine people to make sure that all people in Maine, regardless of their social, economic, or health status, color of their skin, sexual identity, religious beliefs, or age, have access to the healthcare they need when they need it. Kate has worked at Consumers for Affordable Healthcare for several years, first as Kate's legal program coordinator, where she assisted Maine people in appealing inappropriate insurance denials, so denials for coverage when they needed it. She also worked as Maine's Consumer Assistance Program Manager, where she helped people understand their coverage options and enroll in coverage, and also worked with people who were being denied the coverage they were eligible for. And most recently, she serves as Maine's Consumers for Affordable Healthcare's Policy Director, where she's worked with many of you over the last couple of years to improve access to affordable coverage, oral health care, affordable medicine, and has done a lot of work to preserve and expand consumer protections under Maine's insurance code. And I just really quickly need to touch on the fact that Kate is one of very few consumer advocates who combs through insurance company rate filings every year to make sure that those rate filings are accurate and give Maine people the biggest bang for their buck in terms of the coverage they're purchasing. It's hard work, it's complicated work, and we all should be very grateful to Kate for the work and the time she takes analyzing those rates, commenting on those rates in an effort to protect Maine people. There's so much more I can say, and you all know that access to coverage and medicine are basic components to helping reduce chronic disease. Maine people and public health advocates are fortunate to have Kate on their side. She's a powerful force, but she is modest in her accomplishments on behalf of Maine people. And I can't thank you enough for being here today to recognize Kate for the important work that she's involved in. Thank you.
Thank you. Oh, sorry, Kate. You are welcome to go. Please share some remarks.
Thanks so much, Becca, and thanks so much, Anne, for all the kind words, and to the Maine Public Health Association for this recognition, for all the important work it does to improve and promote the health of Maine people. I'm humbled because I recognize that this award is really a reflection of the incredible team I have the privilege of working with at Consumers for Affordable Healthcare. It is the culmination of all of their work, along with the tireless efforts of numerous other organizations and individuals that have collaborated and partnered with us to work towards reducing barriers and improve access to quality, affordable healthcare coverage in Maine. Access to comprehensive healthcare for every person is a fundamental human right, no matter who you are, where you live, or what resources you have. But there are still deep cracks within our healthcare system that many Mainers continue to fall through. This pandemic has only underscored that, as well as highlighted the connection between individual and public health, demonstrating clearly that the health of our families and communities depend very deeply on the ability of all people to access the healthcare services and resources that they need to get and stay healthy. Yet, efforts continue to dismantle the ACA without regard for the current healthcare crisis or the millions of Americans that could lose their health insurance coverage and access to care as a result. While these cracks in our system and barriers that currently exist may be more apparent now, we know they didn't begin with COVID. And we must continue to work to ensure that people can afford the treatment they need if they are ill, and that everyone is able to access the care and coverage to be healthy, whether or not we are in a pandemic. Our strength lies in acting together, and I look forward to continuing this work with MPHA, as well as all of you, to reduce barriers and inequalities within our healthcare system and to promote the health of Maine people. And again, thank you so much for this honor.
Thank you, Kate. Our next award is the Pamela M.B. Studwell Tobacco Policy Award. This award is given to an individual whose dedication, persistence, and passion for improving lives has significantly advanced best practice tobacco policies in Maine. Amber Desrosiers is this year's award winner. Kristen McCauley from the Maine Health Center for Tobacco Independence will now share remarks about why she nominated Amber for this award.
Hi, I'm Kristen McCauley with the Maine Health Center for Tobacco Independence, and this year I was proud to nominate Amber Desrosiers for the Pamela Studwell Tobacco Policy Award. I did not have the good fortune of working with Pam, but I know many who spoke of her passion and dedication. I did have the good fortune of working with Amber when she was the Tobacco Enforcement Coordinator at the Office of the Attorney General. In her role there, she helped countless workplaces and licensed tobacco retailers meet state law. To be clear, this was her job, but what made Amber special was the passion and dedication she brought to the position. She was an exceptional public servant who worked for many years to advance tobacco prevention and control and secondhand smoke policies throughout all of Maine. She was a true public health advocate for many retailers and businesses, ensuring that they were provided with a wealth of resources, guidance, and support. I can't even tell you how many FAQs and other resources she helped to develop. For Amber, though, it wasn't just about whether an organization met law or enforcing the law as her title appeared to be. It was how she could assist in helping them to be tobacco-free or responsible sellers. She brought a public health perspective and approach to something that was not necessarily oriented in that manner. And above all, she did this with a sense of grace, persistence, and an awesome sense of humor. Amber was a true partner to tobacco stakeholders. She could always be counted on to provide a minutiae level of detail to the ins and outs of Maine's numerous and often confusing tobacco statutes. And she always stepped into training opportunities that helped to educate and assist others. While no longer in this position, Amber deserves to be recognized for having deep impact in advancing Maine's tobacco prevention efforts. Thank you, Amber.
Thank you. And with that, I will turn it over to Amber to make some remarks.
Perfect. Thank you to Kristen McCauley for the nomination and to the Maine Public Health Association for being awarded the Pamela M.B. Studwell Tobacco Policy Award for advancing best tobacco policies in Maine. Throughout my public health career, I have been able to establish best practice tobacco policies in elementary and secondary schools, hospitals, public places, outdoor eating areas, tobacco retailers, and workplaces throughout Maine. When I received a award notification from MPHA, I sent Kristen a message saying, "Thank you, you're going to make me cry." Then I quickly replied with, "Correction, I am crying." I was overwhelmed with heartfelt emotion. for being recognized for my passion in public health and professional work in tobacco prevention. Tobacco smoking leads to disease and disability and harms nearly every organ system of the body. Smoking is the leading cause of preventable death in the United States. On average, smokers die 10 years earlier than non-smokers. Furthermore, there's no risk-free level of exposure to secondhand smoke and no safe level of smokeless tobacco use. Tobacco prevention is a passion of mine because I know firsthand the deadly effects smoking can have on the user and their family. My father was a smoker and died of a heart attack at the age of 41. I was only 14. Acknowledging that nicotine is the known addictive substance in tobacco and that regular use leads to addiction and long-term health problems, I was self-guided to take an interest in public health. Tobacco prevention became a part of my identity. It became my passion. It gives me a sense of purpose, both professionally and personally. Receiving this award is heartfelt because it emphasizes that the loss of my father created an opportunity for me to follow a career in public health and to work in tobacco prevention. However, I would not have been able to accomplish this work without the support of my various mentors and supervisors throughout my career. So in closing, I would like to further say thank you to Ellen Wells, Tina Chapman, Stephen Jondro, Joanne Joy, Linda Conti, Vivian McHale, the late Paul Grovero, and the various Maine Center for Disease and Control and Prevention and Maine Department of Health and Human Services personnel for their coordinated efforts and comprehensive tobacco programs for the state of Maine. Thank you.
Thank you, Amber. Our next award is the Public Health Policy Champion Award. This award recognizes a policymaker who has made a significant contribution to public health in Maine. Nathan Poore, City Manager for the Town of Falmouth, is this year's award winner. He was nominated by Zoe Miller from Greater Portland Council of Governments, who will now share some remarks about why she nominated Nathan.
Good evening, everyone. This is Zoe Miller with the Greater Portland Council of Governments, and I'm so pleased to be here to introduce Nathan Poore, Town Manager for Falmouth, and winner of this year's Public Health Policy Champion Award. Nathan is really a model for how municipal leaders can reduce the stigma of substance use disorders. Under his direction, Falmouth has become a leader in promoting trauma-informed municipal policy in Greater Portland and across the state. Beginning in 2017, Nathan worked with GPCOG to identify tactics for addressing the opioid misuse crisis on a regional level. He embraced a public health framework for understanding and addressing the problem that includes prevention, enforcement, harm reduction, treatment, and recovery. When the opportunity came to help develop and pilot the community's addressing addiction and opioid misuse approach, Nathan volunteered Falmouth to be the first community to undertake the project. He led a planning committee of municipal staff to plan and host a workshop for Falmouth officials about the root causes of addiction. Around the planning table, his curiosity and commitment to an honest dialogue led to meaningful discussions and a deepened understanding of the issue. At Falmouth's workshop, elected and appointed leaders turned out to learn together and to create an action plan for tackling the problem with evidence-based strategies. Falmouth's action plan was adopted by the Town Council in 2018, and implementation has included hiring a substance use liaison at the police department and promoting safe and quality recovery housing. Nathan has continued to think beyond the boundaries of Falmouth, encouraging Gorham and then Portland to undertake the project and promoting the approach throughout the state. Nathan continues to be a champion of the project and of the unique and powerful role municipal leaders can play in addressing addiction in our communities. Congratulations, Nathan.
Thank you, Zoe, for nominating our work on this important matter. I may be the person receiving the award, but it was only possible because of the great work of so many other dedicated people, including Zoe, the Greater Portland Council of Governments, Liz Blackwell Moore, the support of the Falmouth Town Council, and the passionate and committed staff from the town of Falmouth. While Falmouth doesn't have the same statistics as other communities, it remains a very significant problem. I can rattle off way too many Falmouth stories about substance misuse disorders, including those unfortunate stories about death. I remember trying to brainstorm how we should as a community address this matter, but always ended up being overwhelmed. When we developed the model toolbox for municipalities, it was so to be less overwhelming and could work for larger and smaller communities. I've learned so much and give credit to Zoe and Liz for all that they are doing to help people like me without a public health background to understand the issues around substance use disorders. Thank you, Maine Public Health Association, for this recognition. And congratulations to everyone winning awards tonight. It's just amazing to sit back here, not being a public health official or in your business, and to see all the good work that's being done around the state. Thank you again.
Thank you, Nathan. Our next award is the Public Health Journalism Award, which recognizes a journalist or team of journalists who have made a significant contribution to public health in Maine. The Maine Monitor is the recipient of this year's award. Jen Gunderman, Director of Maine Area Health Education Centers and member of MPHA's board, will share some remarks about the Maine Monitor's work in public health.
Hi, my name is Jen, and I'm a board member with the Maine Public Health Association. And it is my sincere honor to be having a role in presenting the Maine Monitor with the Maine Public Health Association Public Health Journalism Award. The Maine Monitor has truly put their mission into action by delivering fearless, independent, citizen-supported, nonpartisan journalism that informs Mainers about the issues and inspires them to take action. With ongoing projects focused on substance use disorder, the criminal justice system, and the benefits of immigration, the Maine Monitor is a true champion of public health. Staff and contributors tell stories of Mainers and the issues through genuine narrative, exquisite photos, hard science, and sound data. Their Sea Change series reflects the One Health model in bringing trusted information, urgency, and a call to action related to climate change, its effects on Mainers' health, environment, and the economy. And understanding the challenges with gaining access to important information, the Maine Monitor has made its publication completely free online. And recognizing the need to continue with future generations of fearless and independent journalists and workforce, the Maine Monitor takes students to be contributors. The Maine Monitor coverage of COVID-19 has provided Mainers with up-to-date data, daily headline compilations, and a deep understanding of the social determinants of health. Thank you, Maine Monitor, for fighting the good fight.
Thank you. And now Dan Dinsmore, Executive Director of the Maine Center for Public Interest Reporting and editor and publisher of the Maine Monitor, is here on behalf of his team to accept the award.
Well, thank you, everybody. Thank you, Jen, for those really, really kind words. We were stunned by this award. We were not expecting it. We're committed to public health as a news organization, but we're really committed to the health of local journalism, and we exist because local journalism is in dire shape. The state of Maine has lost over half of its working journalists in the last 20 years, and we're part of the civic news movement that is aiming to make sure that local journalism doesn't disappear totally from our communities. This is very much a team award. I want to share this with Samantha Hogan, Meg Robbins, Rose Lundy, and Barbara Walsh, all of whom have contributed terrific public health content to our site over the last few months. This has been an incredible 8 months of stress and struggle for all of us. I woke up, I think, on Friday, March 13th, and as a publisher and an editor, I figured out what's the best thing I can do today. And so we started to put together a daily email newsletter of all the news and information from around the state that related to COVID, and we've been doing that now for 220 days. I think I did it for 85 straight days without taking a day off. So that was really our first initial coverage of COVID. Since then, we produced dozens of original pieces of content, and we continue to be committed to public health. We've partnered with Report for America, a national nonprofit that's focused on the health of journalism as well, to fund a local public health reporting position. That reporter started in July and she is now up and running. Her name is Rose Lundy. So if anybody has any ideas for stories that we should pursue, or if you would like to subscribe to the Maine Monitor, you can reach out to me. We're at mainmonitor.org. Come find us on the website. I'm easy to find on there. And thank you. We really appreciate the honor. We're a small group, but we're working hard, and hopefully we see you again sometime. Thank you.
Great, thank you, Dan. Our next award is the Public Health Business Champion Award. This award recognizes a business for its leadership and commitment to integrating and promoting public health values into business practices. Hannaford Supermarkets is recognized as this year's Business Champion Award winner. Deb Dietrich nominated Hannaford for this award and will share some remarks now about her nomination.
Hi, I'm Deb Dietrich. Hannaford Supermarkets have a long and distinguished history of investing in healthy families and communities. From being a founding partner and longtime contributor to Let's Go, to major support for the Good Shepherd Food Bank, to Guiding Stars, an innovative store-wide nutrition guidance system, they have been an outstanding industry leader for decades. Today, the Maine Public Health Association is honoring Hannaford Supermarkets for their bold decision to stop selling all tobacco products in their 184 retail stores in 5 states, Maine, New Hampshire, Vermont, Massachusetts, and New York this past July. Sales of vaping products were previously eliminated. Policies like this are an evidence-based strategy to reduce the use of products containing nicotine and the death and disease they produce. This decision was made locally by Hannaford leaders who care deeply about corporate responsibility and sending a strong message to customers like me and hopefully you and their employees and even to their competitors. I'm delighted to introduce Sherry Stevens, Community Relations Manager for Hannaford Supermarkets, who will accept the award.
Thank you. Sherry Stevens, Community Affairs Manager, is here to accept the award on behalf of Hannaford.
Thank you, Becca, and good afternoon, everyone. I want to thank Deb for nominating us for this wonderful award and also express a huge thank you to Maine Public Health Association for selecting us. We are incredibly touched, and I'm truly honored to accept it on behalf of Hannaford Supermarkets. To be described as a champion and role model in the area of health and wellness makes all of us at Hannaford beam with pride. There are so many benefits to living in a healthy community where everyone has the opportunity to make choices in environments designed to promote health. At Hannaford, we believe we have a responsibility to do what we can. To that end, many talented colleagues of mine who care so deeply about these communities that we all live in have invested their knowledge and skills to help our consumers make more healthy choices. This entails creating in-store programs like Deb just spoke about, in-store nutrition navigation programs, dietitians that offer free nutrition education, incredibly professional and knowledgeable pharmacists, and a wide variety of products that meet specific dietary needs, just to name a few. We also work to invest in our communities through charitable donations to community organizations that support the whole health of all members of our communities. We donate an average about $53 million in product and cash donations into our 5-state region each year. So the bottom line is for us that we don't want to just be a part of our communities. We want to be an active participant in our communities. And we believe strongly that together we can all make our world a better place for the long-term health of our communities, our states, and our planet. So thank you again. We are just so grateful and honored for this, to receive this recognition.
Thank you, Sherry. Our next award is the Public Health Rising Star Award. which recognizes a young professional who has made a significant contribution to public health in Maine. Hawa Shir from City of Portland Public Health is this year's award winner. Leanne Dodge, Director of SOPO Unite, will share some remarks now about why she nominated Hawa for this award.
It is my great pleasure to share some kind words about the winner of the Rising Star Award for Maine Public Health Association for Hawa Shir. And I've known Hawa for over a couple of years now, and we worked closely together in the Gateway to Opportunity program a couple of summers ago, where she was our team leader and had been a recent graduate from the University of Southern Maine studying biology. And since then, she has worked for the City of Portland's Public Health Division in tobacco prevention and works in Cumberland County. And she has done over 100 presentations to people of all ages, kids, parents, schools, school staff, all over the county, and has just been a rock star. And she has done trainings of trainers for the Sidekicks program. She's been entrusted to train new staff on the prevention work. And she's just been such an advocate for prevention and has done so much work in the world of tobacco prevention and policy change. And she's excited to take next steps into getting a master's degree in public health down the road. And we've just had such a great connection with her. She's been a big part of our coalition, SOPO Unite in South Portland, one of the drug-free communities. And I'm wishing her all the best and congratulations.
Thank you. Hawa, I now invite you if you'd like to make some remarks.
Thank you. Thank you so much. I'm so honored and appreciative today to be receiving this award. So I have a few thank yous I want to give out. First of all, thank you to the MPHA committee for selecting me for this award. I found such a passion for public health through the work that I do, and this award just motivates me to continue doing more, becoming better, and just growing within the public health field. Working with communities has been such a passion of mine for many years now, so now that I get to be more hands-on with the communities that we live with and learn from every day has been so inspirational, and finding ways to serve their needs has been such an important goal of mine through the work. There are so many people I'd like to thank for being part of this journey with me through the work we do for the health of our communities. So first of all, I want to give a huge thank you to Leanne. Thank you so much for this nomination. Thank you for everything you've taught me. I wouldn't be where I am today without your support and your guidance. You've been an amazing mentor, not only to me, but to all the students that you work with as well. And I just hope you know how important you are to everyone that you've always worked with. Thank you to the entire tobacco team at the City of Portland, Kirsten, Ellie, Nylat, Val, Maddie, Danny. Thank you all for your support. It means so much to me. And thanks for the hard work that you guys do each day. I'm so proud of how much we've accomplished together through this crazy year. I know it wasn't easy, but our collective dedication to the health of our community really pulled us through. I also want to give a quick shout out to the whole CTI team at Maine Health. You guys have also been such a wonderful support in the work that we do throughout the county. I also want to say thank you to Jeanette Dasova. You've really helped me get my feet on the ground in this field. And you've always been there for me through any challenges that we face. Your support and your guidance means a lot to me. I can't thank all of you enough. And lastly, I just want to thank everyone who's allowed me the opportunity to collaborate with you in any setting. The work we do is so meaningful, and the more we can do together, the more it really benefits our community. So thank you everyone who attended here today. Thanks for coming and supporting each other in the work. And thank you all for the amazing work that you guys do too. I look forward to continuing working with all of you in the field and learning more about ways we can better serve our community. Thank you.
Thank you very much. Last but certainly not least is the Unsung Hero Award. As we know, public health is at its best when we don't realize it's serving us. This award is for those who work hard every day to protect and promote public health in whatever capacity is needed and with a commitment to excellence. The award recognizes an individual, department, or organization who has positively influenced public health in Maine from behind the scenes. This year's award winner is Jesse Harvey. Jesse is being honored for his vision, enthusiasm, and tireless commitment to supporting Maine's recovery community. Jesse was a passionate advocate, in particular for needle exchange programs and safe injection sites staffed by trained health professionals. His entire focus was on helping other people experiencing addiction. His commitment and leadership led to the founding of Journey House Recovery, a nonprofit organization that operates low-barrier, peer-run recovery houses in southern and central Maine and offers a range of treatment options, including medication-assisted treatment. Jesse also created a mobile clinic, the Church of Safe Injection, which he operated out of the back of his car to distribute sterile needles, naloxone, food, and condoms. He worked with other harm reduction advocates to develop the policy agenda for the Maine Coalition for Sensible Drug Policy and received Health Equity Alliance's Harm Reduction Hero Award in 2018. Jesse presented at MPHA's conferences several times and worked with us to figure out how we could make the conference more accessible to people in recovery. He was committed to fighting the stigma of addiction and to getting services to the people who needed them most, working at the municipal, state, and even national levels. Unfortunately, Jesse continued to fight his own addiction and passed away in September. His work and dedication continued to live on, benefiting others with substance use disorder on their paths to recovery. Jesse's mother, Catherine Nash, is here with us today to accept the award on Jesse's behalf.
I wanted to thank the people at MPHA and also say that I'm honored and humbled to receive this award for Jesse. As you know, he was a tireless and very courageous advocate for all people who are struggling. He was first a loving friend who took time to talk to and get to know people and their circumstances. When Jesse saw people in need and people in recovery that had no place to go, Jesse founded Journey House to give shelter and recovery options to people who so badly needed them. That wasn't enough for Jesse. He went on to expand to 3 more houses. His vision was to help even more people in need, everyone he met who was in need. When he founded the Church of Safe Injection, that reach became even more extended. The church now serves people in 8 states. Jesse was far ahead of his time. His vision was leaps and bounds more comprehensive and inclusive than anything we're likely to see in this lifetime, though major efforts and initiatives are already underway to achieve that vision. I feel that that is why the Maine Public Health Association selected Jesse as the unsung hero, because despite efforts to silence him, he continued his life-saving work. Jesse personified love humbly and expansively behind the scenes, and Jesse personified love. Thank you for this award on Jesse's behalf, and know that his spirit continues strongly and will guide you in the tremendous work that you all do and continue to do. Thank you again to the Maine Public Health Association.
Catherine, thank you for being here today to accept this award on Jesse's behalf. His vision for changing policies, services, and standards of care, including through a harm reduction public health approach, has improved the lives of many. On behalf of the association, I offer our condolences to you and to your family. His legacy is one of unwavering care and compassion to others experiencing addiction, and truly is an unsung hero. I ask folks to please take a moment to reflect on Jesse's life and his work, and as well as those in our lives who are experiencing addiction. That was our last award of this evening, and I want to thank all of you for being here with us tonight and to congratulate again our award winners. Maine's people and communities are healthier because of your efforts, and your work is very much appreciated. With all that is going on, it has been really nice to spend this evening with you celebrating the work of our public health friends and colleagues. Thank you. I hope that you all have a pleasant rest of your evening.